pain between your shoulder blades, a nagging ache pulling down your arm, and every morning your fingers go numb, swell up, and barely bend? So many people spend years treating their shoulder or their wrist joints, but the real source of that pain is often hiding right here, in the neck. These are the trigger points of the scalene muscles. In this video, we're going to run a couple of simple tests to find out whether that's exactly your problem. I'll show you precisely where these triggers hide, and I'll give you targeted therapeutic exercises that will eliminate the pain and restore full mobility to your hands. I'm Dr. Chernov. Let's get to the bottom of this pain once and for all. To understand how to actually fix the problem, let's take a look beneath the surface. The scalene muscles are a group of deep muscles running along the lateral side of the neck. There are three of them: the anterior, the middle, and the posterior scalene. And a lucky few people even have a tiny fourth one called the scalenus minimus. At the top, they attach to the cervical vertebrae, and at the bottom, they connect to the first and second ribs. Think of them as strong, taut cables that help stabilize and support your neck. But here's the really fascinating part. These are also breathing muscles. With every single deep breath you take, they contract and actively lift the upper ribs. And this is exactly where things start to go wrong. Because of chronic stress, poor posture, or dysfunctional breathing patterns, these muscles become chronically overloaded, and hard knotted spots develop inside them. Those are your trigger points. And the anterior scalene, the front one, is by far the most commonly affected. So where exactly do these triggers send their pain? First, they can radiate into the front of the chest wall. And here's a really common and genuinely frightening mistake people make. When a trigger develops on the left side, the chest pain can become so intense that people are absolutely convinced it's a heart attack. They rush in for an EKG, but the cardiologist tells them everything looks completely normal. Meanwhile, the real problem has been hiding in the neck the entire time. Second, the pain can shoot directly into the area between the shoulder blades, travel down both the front and the back of the arm, and radiate all the way out to the thumb and index finger. But the pain itself is really only half the story. Take a look at this. Running right between the anterior and middle scalene muscles is the brachial plexus, a dense bundle of nerves and blood vessels that supplies the entire arm. When these muscles go into spasm, they literally choke and compress that neural bundle. And that compression is exactly what produces these strange and confusing symptoms. Morning numbness and tingling in the hand, exactly like you slept on your arm all night. Unexplained swelling and puffiness in the fingers. Rings won't come off, and the whole hand feels thick and stiff. Chronically cold hands. Because the blood vessels are being compressed, circulation gets disrupted, and your hand can feel ice cold nearly all the time. Muscle weakness and sudden loss of grip. Has a cup of coffee ever just dropped straight out of your hand for no apparent reason? That's these muscles at work too. Because of this relentless, aching pain in the arm, people simply cannot get a decent night of sleep. You might notice a strange habit developing. You actually want to sleep on the painful side, because in that position the muscles get a little bit of slack and ease off slightly. Or here's another classic tell. While you're asleep or even just sitting at your desk, you unconsciously reach your hand up to rest on top of your head or tuck the arm behind it. In that position, the tension on the nerve releases, and the aching in the arm finally quiets down. Does that sound familiar? Go ahead and let me know in the comments. So where do these hard, painful trigger points actually come from in the first place? Let's check whether you fall into any of the at-risk categories, because some of the causes are surprisingly non-obvious. First, your everyday daily routine. A head that juts forward, especially if it's also tilted slightly to one side, is the classic culprit from hours of working at a computer or constantly looking down at your phone. Add to that a poorly fitted pillow that keeps your neck in a twisted, misaligned position for hours throughout the entire night. Second, because the scalenes are directly involved in the breathing process, any prolonged and heavy coughing from bronchitis, pneumonia, asthma, or even a severe allergic reaction pushes these muscles right to their absolute limit. They work themselves to exhaustion just trying to help you pull in enough air. Third, there's the specific nature of your work and your hobbies. Musicians are especially at risk, particularly those who play violin, cello, or wind instruments. Athletes are vulnerable too, beyond swimmers and equestrians. Think cyclists who spend hours leaning forward with the neck craned up, tennis players, weightlifters, and CrossFit athletes who constantly strain the neck when lifting heavy loads overhead, and even distance runners who, once fatigue sets in, shift from belly breathing to chest breathing and start hiking their shoulders up with every single inhale. And finally, there are traumatic injuries and structural changes to the body. This includes whiplash injuries to the neck from car accidents, the presence of scoliosis, and major surgical procedures that fundamentally alter the body's biomechanics, such as a mastectomy or an arm amputation. Alright, enough theory. Let's get into the practical work. Right now, wherever you're sitting or standing, do these two simple tests along with me. They will clearly reveal whether your scalene muscles are actually the problem. Test number 1. Sit up straight and tall. Now rotate your head all the way to the right as far as it will go, and then drop your chin down toward your collarbone, pressing it in as firmly as you can. Do you feel a sharp pain or a strong, intense tension along the side of the neck? Now go ahead and repeat that exact same movement to the left side. What did we just do? In that specific position, we're maximally contracting both the anterior and middle scalene muscles simultaneously. If active trigger points are lurking inside them, this test will trigger an immediate and unmistakable pain response. Test number 2, finger mobility and flexion. This one is excellent at revealing hidden nerve compression problems that you might not even be aware of. Watch my hand carefully here. What we need to do is curl the fingers down so that the fingertip pads touch the base of the fingers, right at the top of the palm. But here's the critical part. The upper knuckles, the MCP joints, must stay completely straight and extended throughout the movement. Notice the difference carefully. Doing it like this, squeezing into a regular closed fist, that's not what we want. But doing it like this, that's exactly right. If all of your fingertips easily and painlessly press flat against the palm with no resistance, great, everything is working the way it should. But if your fingers feel wooden and stiff, can't reach all the way down, or you feel significant pulling tension, that is a clear sign of dysfunction in the long flexor muscles of the hand. And most of the time, that's a direct downstream consequence of trigger points in the scalene muscles on that same side of the neck. Go ahead and drop a comment letting me know whether you passed both of those tests. And now let's move on to the most important part. How to actually treat this condition and which specific exercises are going to eliminate that pain. To get fast and lasting relief from pain, physical therapy has one fundamental golden rule. First, you mechanically release and break up the trigger point, and only after that do you stretch the muscle out. The scalene muscles hide quite deep beneath the surface, so reaching them effectively will take just a little bit of technique and practice. And right away, one important safety note. Before you attempt any self-massage on the neck, make sure your fingernails are trimmed short. Otherwise, you'll simply end up scratching and irritating the skin rather than treating the muscle. Take a look at this diagram here. Our key anatomical landmark is the sternocleidomastoid muscle, or SCM. It's a large prominent muscle that sits right on the surface, and you can locate it instantly by simply turning your head to either side. Let's begin with the anterior scalene muscle. It hides directly underneath the sternocleidomastoid. To access it, grasp the sternocleidomastoid between your fingers like this and gently push it forward and slightly out of the way. Now, using your fingertips, slowly press inward and deeper into the neck, compressing the anterior scalene back against the spine. You'll immediately feel a notable difference in texture. The scalene muscles are significantly firmer and denser to the touch than the superficial muscles above them. Work your way down with slow, gentle, sustained compressions, moving from the level of the angle of the jaw all the way down to the collarbone. Important warning, be extremely mindful and controlled with how much pressure you apply here. If you land precisely on an active trigger point, you may experience a sudden, intense shooting pain, almost like a brief electric shock. That is completely normal and expected. Do not press with full force. Once you locate that painful point, apply firm but tolerable pressure and hold it steadily for 15 to 30 seconds. Then release, gently massage and rub out that area and compress again. Repeat this entire cycle 3 to 5 times. Working the middle scalene muscle is somewhat more straightforward. It's a larger and more substantial muscle. Keep your hands in the same general position but shift your fingers slightly back toward the lateral surface of the neck. The lower portion of this muscle has no overlying structure covering it, so accessing it will be noticeably easier. The technique stays exactly the same. Locate the taut band or nodule, apply sustained pressure, hold, then release and rub it out. And finally, the posterior scalene muscle. This one runs nearly horizontally across the neck. Find the anterior border of the trapezius muscle, right here, just above the clavicle. Place your middle finger just under that border and slowly slide your finger parallel to the collarbone, moving toward the center of the neck. The hard, bony structure that your fingertips eventually bump into deep inside, that is the top of your first rib, and that is precisely where you need to search for and release the trigger points of the posterior scalene. Excellent. We've released the triggers, but that's genuinely only half of the work. To prevent the spasm from returning and locking back in, you now need to properly and thoroughly stretch this muscle out. And we're going to do that right now, working through 3 distinct positions. The safest and most effective option is lying flat on your back. Let's say we're working on the right side. Firmly tuck the right hand under your glute. This anchors and stabilizes the shoulder down toward the floor. Then use the left hand to gently cup and cradle the head from above. Now here's the key. We're going to target all 3 scalene muscles one at a time in sequence. To stretch the posterior scalene, tilt your head to the left and rotate your face to look to the left as well. For the middle scalene, keep the same lateral tilt to the left, but now rotate your face to look straight up at the ceiling. For the anterior scalene, maintain that lateral tilt to the left, but now rotate your face to look to the right. Hold each of these 3 positions for a full 1 to 2 minutes. Breathe slowly, deeply, and calmly throughout. Then switch your hands and make sure you repeat the entire sequence for the left side of the neck. If lying down isn't an option for you, perform the same stretches while seated in a chair. Simply sit on your hand to anchor the shoulder down and use the other hand to guide the head through those same 3 directional tilts. And for the more advanced version, there's a standing variation. Clasp both hands behind your back, pull them gently downward toward the floor, and perform those same neck tilts from there. Choose whichever option works best for you and fits your situation. Now here's a super critical point that most people completely overlook. Do you know why the scalene muscles get chronically overloaded and tense in the first place? It comes down to the way that you breathe. If you're a chest breather, these small but hard-working muscles are forced to lift your rib cage tens of thousands of times every single day. They simply get exhausted and overwhelmed. To give them the relief they need, you have to restore your natural diaphragmatic breathing, belly breathing. Sit down in a chair and lean back just slightly. Take a slow, deep breath in through the nose, letting your belly expand and balloon outward like a ball. Then a long, slow exhale through the mouth. The body tilts gently forward, and the belly draws back in. Practice this for a couple of minutes, and really settle into that natural rhythm. Make it a habit to come back to this breathing pattern throughout the day. Your neck will genuinely thank you, and your digestive system will run like clockwork as well. And to close things out, here are the essential ground rules to keep the pain from ever coming back. Avoid carrying heavy loads with your arms extended and hanging down at your sides. Stay on top of your posture. Tech neck, where the head creeps forward toward the monitor or the phone screen, is the single biggest enemy of your scalene muscles. In cold weather, always wear a scarf around your neck. It sounds overly simple, but cold drafts can trigger an immediate protective muscle spasm in the neck. And the most important thing for overnight recovery, to allow the scalene muscles to fully rest during sleep and stay in a truly neutral position, I strongly recommend sleeping on your side and taking the time to find the right firmness level and height of pillow that works specifically for your body. And one more critically important point before we finish. Remember the sternocleidomastoid muscle, the one we were pushing aside with our fingers earlier today? The thing is, it almost always goes into spasm together with the scalene muscles as a connected pair. And if you don't release and address the SCM as well, the pain in the neck is very likely to come right back, and quickly. Go ahead and click on this video on your screen right now. In that one, I walk you through a detailed step-by-step guide on how to find and eliminate the trigger points in the sternocleidomastoid muscle all on your own. Make sure you watch it immediately after this one. And to keep the muscles of your neck and back consistently in their best possible condition, work through my full structured training programs as well. If today's video helped you understand the real root cause of your pain, share it with a friend who needs to hear this, hit that like button, and subscribe to the channel. This has been Dr. Chernov. Stay strong and healthy, and I'll see you in the next video.